And now I'd like to introduce our first speaker this evening, Dr. Rinat Nissim. Dr. Nissim is a staff psychologist at the Princess Margaret Cancer Centre and an assistant professor at the Department of Psychiatry at the University of Toronto and an adjunct professor at the Department of Psychology at York University. Her clinical and research work is focused on psychosocial needs of individuals impacted by cancer, with the global development, goal of developing evidence-based psychosocial interventions for individuals diagnosed with cancer, their family members, and their health care providers. Welcome, Dr. Nissim.
So my name is Rinat Nissim, and I've had the privilege of serving as a psychologist at the Princess Margaret Hospital for the last 6 years. I help individuals with a cancer diagnosis and their family members. And this presentation will be based on my clinical experience. I have to say that I don't usually see individuals with melanoma or their family members, but I hope that the presentation today will help you kind of see what we do and how we can help you. So what I hope you will take away from this presentation is that anxiety is normal and that it's common. It makes sense for us to feel anxious and afraid when we are hit with a cancer diagnosis. The goal of this presentation is not to give you tools to not be anxious. It's about giving you tools to learn how to be anxious in a way, how to be anxious in a productive way and in a way that does not overwhelm you, because it is not realistic to eliminate anxiety and fears. It was really important for me today to speak also about the distress and the needs of family caregivers. As you know, cancer is a family experience, and we've done a lot of studies about family caregivers, and what we see consistently is that their level of distress is the same or sometimes double than the distress of the individuals with the diagnosis. So it was really important for me to talk about that. Everything that I'm going to say about tools for anxiety applies for family members as well, and at the end I want to address some of the unique challenges of family caregivers. I also hope to give you a very brief list, a very incomplete list about our resource at Princess Margaret and about different community and online resources that you may find helpful. So as I said, it's common, it's normal to feel anxiety, to feel afraid. A cancer diagnosis, being diagnosed with a potentially life-threatening illness, is trauma by definition. And the fear that we're feeling is part of the nervous system activation in order to respond effectively to threat. Cancer also brings a lot of uncertainty. And uncertainty, by definition, brings both hope and fear. There are many different fears that are experienced by individuals with a cancer diagnosis and their family members. I'm going to focus in this presentation mostly about the fear of recurrence, the fear that cancer may come back or that the fear that cancer may progress. Now, fear, like all emotions, fear is information. Fear is a signal. It's our alarm system. It's a signal, a useful signal to tell us that there is a threat, that there is a conflict, that there is unmet need that needs to be addressed. And it's productive. It's a very useful tool that we have, and it can motivate a lot of time helpful, productive action. So for example, fear is what will make us seek medical attention, for example, or will make us make changes to our diet. Anxiety can become unproductive and problematic when it's excessive, and instead of promoting helpful action, it actually interferes with our everyday life. Now, when I talk about anxiety, I talk about three different components. There is the mental component, our thoughts and our feelings. There is the physical component, and there is the behavioral component. And they always work together. When we think about anxiety as problematic, and anxiety that needs to be addressed, we usually see unproductive thoughts. So for example, it can be regret about the past, I should have, or if only. It can be a lot of times we see black and white thinking about the future. This will never get better, or a sense of being overwhelmed and I can't do this, or I won't be able to cope with this. Sometimes we see not so much thoughts, but more feelings. So, and it doesn't have to be the feeling of anxiety. Sometimes we actually see anger and irritability. So some people actually become more angry, but there is actually underlying anxiety there that needs to be addressed. Sometimes we are not really in touch with the anxiety, with the underlying anxiety, but it manifests with inability to concentrate, with feeling on edge. Sometimes we experience intrusive flashbacks about distressing events from the past. A lot of times, for a lot of people, they are not so much in touch with the anxiety, with the emotion, but they experience it physically. Anxiety always manifests in our body. So common symptoms will be muscle tensions. A lot of people will feel pressure in the abdomen and not in the chest area, difficulty sleeping, loss of appetite. Sometimes those physical symptoms and the anxiety is very sudden and acute, and then we call it an anxiety attack or a panic attack. And a very, very important component of anxiety is the behavioral component. As I said, emotion usually motivate action. And usually anxiety, especially anxiety that is a concern, will motivate avoidance. So for example, if we're anxious about our appearance, we may avoid certain social situations. Self-medicating with drugs and alcohol, that can be another form of avoidance, because we don't want to feel the anxiety, and sometimes we actually don't feel the anxiety, so it's effective that way, but these behaviors have their own problems. Sometimes anxiety overwhelms us and it creates paralysis. We feel like we can't take any action. Sometimes anxiety actually makes us take too much action. So, for example, we can be checking over and over again our bodies, or we can seek medical reassurance over and over again. Now, anxiety that is a concern is usually a result of a buildup, of a downward spiral, where the mental, physical, and behavioral components build on each other. So a classic example will be that anxiety that something may be wrong in our body actually results in physical symptoms, because anxiety always manifests in the body. These symptoms make you more convinced that something is wrong in your body, and this brings more anxiety. The anxiety brings more physical symptoms and more behaviors such as self-checking that also reinforce the vicious cycle. Now, anxiety usually comes in waves. So when I ask people, if they can rate their emotional distress on a scale from 1 to 10, they usually say it depends. And they say, I have bad days and I have good days, or I have bad moments and I have good moments. So it usually comes in waves. And some of the triggers of those waves are pretty predictable. So for example, a lot of individuals experience anxiety. Of course, there is a peak at diagnosis. A lot of times we see a lot of anxiety just before starting treatment, because there is so much unknown, and we see a big peak there. Sometimes, we can predict that there will be a lot of anxiety before scans, medical appointments. Sometimes the anxiety is actually after the scan, when you're waiting for the results. The waiting period is extremely difficult for the mind. Sometimes we can predict that there will be anxiety at certain anniversary events. So, for example, the date of surgery, the date of diagnosis. But this can also be during good events like birthdays. Sometimes there will be a peak of anxiety. Sometimes it's in relation to physical symptoms, and that can bring a wave of anxiety that something is wrong. Now, some triggers of anxiety may be confusing, and they seem to the wave of anxiety seems like it's coming out of the blue, and we don't really understand why it's coming. So, for example, as I mentioned, sometimes, a wedding anniversary or birthday, Christmas can actually bring anxiety, and that's normal. I think that the most confusing yet very, very powerful trigger of anxiety is the end of treatment, when treatment is completed. From my experience, this is actually where when we see it, psychosocial oncology, we see most of the people that are referred to us, they come at the end of treatment and they're experiencing this big wave of anxiety. And I know it may seem confusing, but it actually makes a lot of sense. At the end of treatment, there are all kinds of expectations that didn't necessarily exist during treatment. So for example, this is the time where I should be overjoyed and happy. Why am I not feeling this way? Or there is a sense of urgency to go back to normal and frustration about the fact that it's taking so long. Treatment actually creates a sense of structure. You kind of focus, you put your blinders on and you just focus on the treatment. It creates a sense of safety because there is a lot of medical attention. So at the end of treatment, there is a lot of times a sense of abandonment and that you don't get the medical attention that you're used to. Also, during treatment, you don't need to think about, what am I going to do next? And then at the end of treatment, this thought about what am I supposed to do now creates a lot of anxiety. And just like a soldier returning from battle, end of treatment is the time to process emotions. All those emotions that we had to bury during treatment resurface. It's also the time, regardless of the result of treatment, even if it's very, very successful treatment, this is actually the time when individuals grieve. Because cancer brings losses and the treatment brings losses, and we need to process that and to grieve. So a lot of times I see people where they tell me that they feel anxiety, but underneath it there's just a lot of grief about these losses. Some of these losses are very concrete, changes in our bodies, changing in our physical ability. Some losses are not as concrete. So for example, cancer kind of, can create a change in plans for the future, and we need to grieve that and the fact that we need to revise those plans. Cancer shatters the illusions that we all tend to hold when we are healthy. The illusion of certainty, the illusion of control, the illusion of invincibility, and after cancer, it's very hard to go back and hold on to these illusions, and we need to grieve that loss. There is also a loss of trust in your body. You don't really understand your body anymore, and it takes time to regain that trust, and that process can create a lot of anxiety. Also, very, very consistently, in every domain in our life as human beings, we tend to underestimate how long it will take us to accomplish things. And that's what we see a lot of times at the end of treatment, when people underestimate the time that they need to recover from treatment. That, coupled with the urgency to kind of go back out there and kind of make up for lost time, can create a lot of anxiety. Also, it's very hard at the end of treatment because a lot of times people don't really understand anxiety at that time. They expect you to be happy, they expect you to be back to normal, and they may not be as available as they were during treatment. So it can be the time when you feel the most in need of support but least able to ask for it, and when it seems least available. Another concern, another anxiety that we often see at the end of treatment is the fear of cancer recurrence. This is a universal concern of individuals with a cancer diagnosis. We've done studies in our center. There has been other studies in many different centers consistently. Fear of cancer recurrence is ranked as the most or the second most after fatigue, frequent concerns in individuals who completed treatment for cancer. It's a universal concern. It happens with all cancer types. We do see that it's more severe in women and in individuals who are younger. It lessens over time. It does get better over time, although it's been reported, years, 5 years, 10 years, 15 years after the initial diagnosis. But sudden re-experiencing is very common. So I see, for example, a lot of people who come and they have this wave, again, of fear of cancer recurrence at the 5-year mark. So it's very, very common. It's normal to experience that. We define clinical fear or problematic fear as fear that is characterized by chronic thoughts about recurrence or progression that impact daily functioning and impact the ability to make plans for the future. I've been looking for studies that investigated this in individuals with melanoma, and these studies shows that 50% to 75% of individuals with melanoma report clinical fear of recurrence. It really makes sense to have fear of cancer recurrence. And this is because as human beings, we are hardwired to dislike uncertainty. In fact, we dislike uncertainty so much that when they've done an experiment, when they told people that you are going to get an electric shock, or they told them that you might get an electric shock, those who were told that they are definitely going to get an electric shock showed less fear than those who said that they might get it, those who were told that they might get it. So it really shows you how much we dislike uncertainty and how much we feel fear when we are faced with uncertainty. So my point is not to help you, as I said, to not be anxious. It's normal, it's common, it's not really realistic for us to think that we can eliminate fears or anxiety. My point is to give you tools to help you be anxious in a productive way. And you know, probably a lot of you already have tools that you use effectively, so this is not necessarily saying you need to replace your tools. Keep doing what you're doing if it's effective, but I can maybe expand your toolbox and offer you more tools. The tools that we often suggest that we find to be very productive, we call it radical acceptance or dropping the rope. And this is based on the idea that we tend to be in a tug of war with our anxiety. So when we feel anxiety, we tend to resist it. We tend to fight with it. First of all, we don't like it. You know, nobody likes to feel anxious, so we want it to stop. So we really want it to go away. Sometimes we dismiss our anxiety. We think that it's silly to feel anxious. Why am I feeling anxious? I shouldn't be feeling anxious. I should be positive. So we have a tug of war in that way. Sometimes, and that's something that I see a lot of times, is we feel that it's dangerous to be anxious. We have fear of being anxious. That's because we think that the anxiety is going to overwhelm us. We think that it's going to paralyze us. Or a lot of times I see individuals who feel that if they're anxious, it will actually bring their cancer back. It's affect their chance of recurrence. Sometimes we're really disappointed with ourselves and we're really hard on ourselves because we feel like I should be able to snap out of it. And why can't I just control my anxiety? So we are engaged in a tug of war with our anxiety that way. Now, the tug of war to pull the rope, it's kind of our instinct. You know, we have this urge to resist this experience, this unpleasant experience, but it actually escalates our anxiety, and it's exhausting. It's exhausting to be in a tug of war with our anxiety. So it actually depletes our resources and makes us less able to cope with the anxiety when it comes. When we drop the rope, when we're doing this paradoxical thing, the anxiety is still there, but we are no longer tied up in a struggle with it. Instead, we can do something more useful. We have more, we don't lose our energy to this battle, and we can do something else. Dropping the rope is very counterintuitive. As I said, we have, you know, all our instincts scream at us to pull the rope, but it's the most productive action. And when I was actually recently describing it to a patient, he was saying to me that I should use a Canadian example, which is, one of the first things that I learned when I came to Canada is that when you lose control of a vehicle on an icy road, you need to learn to turn into the slide. And you should not step on the brakes, right? So although every instinct, screams at you that you need to stop this and step on the brakes, actually it's the least productive thing you can do. So this is, a Canadian metaphor to explain this. Actually, my favorite metaphor is to think of anxiety as, waves in the ocean. And when there is a big wave, if you're in the ocean and there is a big wave that is coming at you, you can try to run away from it, but it will be faster than you and it will knock you down. You can try to stand up and resist it, but again, it will be stronger than you and it will knock you down. So the best thing, the most productive thing to do when a wave comes crashing is to dive deep, is to dive under and let it wash over you. And this is exactly what we're trying to teach people when they're dealing with anxiety. Now, radical acceptance, to kind of let this wave wash over you, does not mean that you like the anxiety or that you agree with your anxious thoughts or feelings. It does not mean that you give up to your thoughts or feelings. It just means that you are observing them. You're kind of letting them come and go like waves instead of getting all tangled up in them. So how do we dive under? How do we let the anxiety wave wash over us? So the first thing to do is to acknowledge and observe. A lot of times it's very fast, very automatic. Sometimes it's hard for us to recognize that we're starting to feel anxious. So it's important to acknowledge and observe it. And when an anxious thought comes to mind, it's important to notice it and not just notice the thought. So you can identify the thought, but it's also very important to identify the impact on your body. Where do you feel anxiety in your body? Is it in the chest area? Is it in the abdomen? Where is it for you? You can also notice the behavioral implication. What does it motivate you to do? When we have a wave of anxiety comes and we want to kind of let it wash over us, it's a lot of times helpful to remind yourself about this metaphor, that it makes sense to have anxiety and that it's just a wave. So from time to time you will experience a wave, and like a wave, it will start coming, it will reach a peak, and then it will go away. One of my favorite quotes is that you don't have to believe everything you think. And when anxiety comes, sometimes it's helpful to remind yourself that you don't need to argue with your thoughts, you don't need to believe them, you don't need to identify with them. These are just thoughts, and like any thoughts, they will come and go. Sometimes, the wave of anxiety is really strong. It feels like a tsunami. And we are completely overwhelmed and we can't do any of those things. Sometimes then at that point what's helpful is to just remind yourself that emotions are never permanent, that this is a moment and it will go away. It will pass like any other moments, like any other wave of anxiety. Sometimes, it's very hard to kind of not engage in this tug of war and not to try to resist and fight the anxiety and then feel bad about not being able to stop it. It's important at those times to talk to yourself like you would to a good friend. It's actually amazing to me, when I sit with patients to hear the way they talk to themselves. We are very, very hard on ourselves, and we a lot of times will say things to ourselves that we will never say to anybody else. And if we heard those things from other people, we will not want to be around them. And it's important to remind yourself that, can I talk to myself differently? Can I imagine a good friend in this situation? And what would I say to a good friend? And try to talk to yourself that way. When we want the wave to wash over us, it's very, very important to find an anchor in the water. And kind of be still until this waves comes and goes. Our breath is the best anchor because it's always available for us. There are many different ways to anchor ourselves in our breathing, and I can suggest some to you, and you kind of need to experiment with that and see which one fits you. Now, when we are trying to kind of anchor ourselves in our breathing while we feel this wave of anxiety, this is actually a very hard thing to do because we tend to kind of engage in a tug of war with our anxiety. We tend to kind of engage with those thoughts and those feelings. Our body is reacting and our body sometimes forgets to breathe, so it's very hard. That's why it's important to kind of do something in addition to breathing. So for example, you can use counting. Just counting 10 breaths can help, because the counting can give you focus and help you anchor yourself in your breath. You can use a mantra or a simple phrase in order to focus on your breathing while this wave is washing over you. One simple phrase that a lot of individuals I worked with find helpful is to take one breath in, and when you take one breath in, you say one for me. When you when you breathe out, you say one for, and you think about someone you like, someone you love, someone important in your life. So you go one for me, one for someone else, one for me, one for you, and you just keep doing it until you feel like the wave passed, and if it comes back again, you can just do it again. As I said, a lot of times we feel tension in our body, in the chest area or the abdomen area. So a lot of times it's helpful to place your hand on your heart, on your chest, or on the abdomen where you feel the tension, and kind of focus on the sensation of the breathing, of your chest rising, and that can help you anchor yourself in your breath. Sometimes it's helpful to visualize, use a relaxing image while you're focusing on that. Sometimes it's good to, have an object at hand. So, for example, a rock, and you can just focus on the sensation of holding that rock while you're anchoring yourself in your breathing. Sometimes people use guided meditation, so they can have audios. Now you can have it, a lot of those guided meditations on your phone, and you can just listen to it, and it can help you do this anchoring process. Now, when we are practicing radical acceptance, when we are no longer engaged in the tug of war, we can actually make this wave of anxiety not as strong as it would be if we're engaged in the tug of war. And then we can really go back to the original purpose of our anxiety. Anxiety is information. It's a signal for us that we need to do something, and we can go back to learning from our anxiety instead of resisting it and fighting it. So we can, if we feel all of a sudden a lot of waves, maybe there is a physical trigger. Maybe there is pain that needs to be addressed. Maybe there is a sleep issue that needs to be addressed. Maybe it's a treatment side effect, and then, we can address it with medications. Sometimes, we can learn that our anxiety is about an unmet information need. Maybe we need to seek more information, and that can bring us relief. Sometimes it's a relationship issue that needs to be addressed. It's also good, when we are dealing with anxiety this way, we can also prepare for it. So as I said, sometimes, we can predict the triggers of our anxiety, and we create a plan for days that we expect to be more, wavier, to be wavier than others. So we can create a plan where, we don't take on too many things, at periods when we expect to be anxious, or we, talk to, people who we know gives us comfort, and so on. Now, when we're trying to deal with anxiety this way, it's very, very important to be patient with yourself and to practice. So, a lot of times when we think about progress, and that's true not just with our ability to deal with anxiety, it's true for anything in life, we kind of assume that progress is a linear line. And it never looks like that. It always looks like ups and downs and all kinds of, weird maneuvers. So it's really important to be patient with yourself. And if there is, waves of anxiety that overwhelm you, that's okay. Then you just start again and practice. Now, if some of the tools I suggested, appeal to you, it's very, very important to practice them when you're not as anxious, So a lot of people, for example, try some of those tools first thing in the morning as a way to practice. And it's important because your mind needs to remember to use those tools when you're feeling anxious. So if you practice when you're not as anxious, it helps your mind remember those tools when you really need them. You don't need to do this alone. There are many different resources that can help you. So as I say, I work at the Psychosocial Oncology program at the Princess Margaret Cancer Center. We see a lot of individuals, family members, couples. We offer individual sessions to kind of deal with anxiety. We also offer many group programs to learn tools together for managing anxiety. Another program that we have the Survivorship Center that also offers many different group programs and individuals programs. There are excellent community resources, free. All of this is free of charge. I'm sure you're familiar with Wellspring and Gilda's Club. In terms of online resources, there is Cancer Chat Canada that recently expanded to Ontario, and they offer online support groups. And if you like the tools that I suggested and you want to add them to your toolbox for dealing with anxiety, there is now an online course offered by the University of Regina free of charge, and it's called Wellbeing After Cancer. And it's available for individuals from Ontario, and you can just go to their website and register. Now, a program that we're actually starting this year at Princess Margaret is called Caring for the Caregiver. And we created this program because we really felt that we need to have a specialized clinic for family caregivers to address family caregiver distress. Informal caregivers make significant contribution to the overall care of cancer patients. Really, the healthcare system can't do this without family caregivers. And as I said in the beginning, the levels of emotional distress, including fear of recurrence, reported by informal caregivers are equal to or higher than those reported by the patients themselves. The problem is that most cancer care is organized around the patient as the target of care. So a lot of times caregiver distress is not really screened for and it's not really addressed. The studies that we've done about caregiver distress, we find that there are some unique challenges for caregivers. One is that caregivers tend to dismiss their distress and their needs. They feel that, their needs are secondary, they're not the patient, or that, their needs are not legitimate, and they don't really take time to address it. And I think that's also kind of a shared problem with the healthcare system where we don't tend to attend to it as well. A lot of times, if family caregivers, what we found is that when family caregivers want support, but the patient does not want support, it's very hard for family caregivers to access that support or get the information that they need. So, a lot of times, it's in medical appointments, for example, it's the patient that asks the questions, and sometimes there are questions that family caregivers want to ask about things that are distressing for them, but they feel that they can't ask that because the appointment is really for the patient. So, what I would like to offer you today to family caregivers, just to validate for you that it is normal to feel all of those difficult emotions that you may feel from time to time. And as I said, a lot of times we tend to talk to ourselves in a very negative way. And we see that a lot with family caregivers. We call it the inner bully. And it's really important to recognize that, and as much as you can, replace your inner bully with self-compassion. Talk to yourself like you would talk to a good friend in a similar situation. I also want to say just a few things about relationship and cancer. It's kind of like the communication, the relationship between patients and caregiver. It's like a dance, that we do together. And when we study this dance, we find that partners, both the patient and the family caregivers, tend to actively hide their negative emotions from each other. And a lot of the couple intervention that we do in our department is about changing this dance and helping both patients and caregivers acknowledge the anxiety in themselves and in their partner, and kind of talk about the elephant in the room, that we both feel anxiety and we both go through the same thing, and then it gives us more opportunity to feel connected to each other, because this dance where we tend to actively hide emotions from each other creates a disconnect. As I said, cancer brings uncertainty, and uncertainty by definition brings both hope and fear. And a lot of times in this dance, it's very hard to talk about the fears, and it's very hard to, it's easy to kind of hope for the best together, and it's very hard to plan for the worst together. And that's something that we, in our department, when we see couples, we try to help with. How can we do both and not just one? How can we hope for the best and plan for the worst? Because what we find is that we actually take the time to plan for the worst together. There is a huge deal of relief, because now we don't have to worry about that. We have a plan in place, we have some kind of control, we ask all our questions, and now we can really focus on hoping for the best. This is my last slide. This is, what you see here is a Japanese pottery technique of mending broken objects by filling the cracks with gold, to represent the belief that when something suffered damage and has a history, it becomes more beautiful. And I just want to leave you with that, because I think this is a great illustration of the fact, I talked a lot about trauma and about anxiety and about fear, but trauma does not only bring distress and anxiety, but it also brings growth. And in fact, studies that look at the levels of post-traumatic growth and post-traumatic stress show that they are directly related. So actually, when you experience a lot of post-traumatic stress, you are also likely to experience more post-traumatic growth. Thank you.